Everyone. If you can see me, my name is Emily Billow, and I'm the Older Adult Program Manager here at the Seattle Public Library. And today we have People's Memorial Association as well as End of Life Washington sitting over there. We do this program both in person here at the West Seattle branch. We do have a few folks in the audience, so thank you for coming all the way down here. Um, as well as virtual. And we have quite a few folks in the room today. So thank you all for joining. I'm going to let Beverly with PMA take it over. If you do have any questions in the chat, feel free to type them to Emily at SPL, and then I can get them answered on here, or at the very end, if you want to unmute yourself, we'll have some time for that. And if not, we just thank you for coming to programming at the Seattle Public Library and look forward to this presentation. So take it away, Beverly.
All right, awesome. Thank you so much for joining. I'm going to just turn a little since we do have a couple folks with us. So welcome to the final session of Ducks in a Row. Today we're going to talk advanced directives for healthcare. Before beginning, we want to go ahead and take this time. It's an incredibly beautiful time of year where this is even more on our mind than normal. PMA would like to acknowledge the traditional, ancestral, unceded territory of the Coast Salish, Duwamish, and Suquamish nations on which we work and live here in the incredible Pacific Northwest. Couple standard housekeeping items. We are recording today, so don't worry if you're scrambling to get all your notes down. We don't want you to give yourself a hand cramp. Emily's going to be sharing the recording out by email, and you can also access this on SPL's YouTube. So, if there's anything you miss, you'll be able to review that, and we can also make sure that we share the slides from today with you by email if you'd like those as a reference as well. So hopefully that helps you just kind of focus on soaking in all the information and not scrambling too much. And also on SPL's YouTube channel and ours at People's Memorial, there's just a ton of different information on there. So, if you get a little bored this weekend and could use a, little light entertainment, maybe there's something on there to help you expand your knowledge. That's why we put that stuff there for you. And we want to make sure, there's going to be just a ton of information you're going to hear today. And it's really common to have lots of questions. And like Emily said, at the end, we're going to tackle as many of those as we can possibly handle. And we do find, though, that, sometimes the questions you might have are pretty personal in nature, or maybe you just don't think of them until 11 o'clock tonight when you're washing your hair. This won't be the last time you hear from us or from my colleague over here from End of Life Washington. So we'll make sure you have contact information for both of our organizations so you can connect up anytime to resolve any of those questions you've got. So if this is your first time joining us, my name is Beverly. I'm the Communications Manager over at People's Memorial Association. We're the oldest and largest memorial society in the country, founded here in Seattle 85 years ago, if you can believe it. I think we don't look half bad for our age, frankly. We just love what we do, providing funeral education and consumer advocacy services to all Washingtonians. To date, over 220,000 folks have become members of PMA, and of those, about 71,000 of them are currently living. So as you can imagine, our teeny tiny staff of 4 stays incredibly busy. And when we think about, the work that's keeping us so busy, well, community education like this is one of our highest priorities. We're just out in libraries and senior centers and gosh, you name it. And we probably have got a table out there with some brochures. We just want to make sure we have these chances to connect with people out where they live in their community to get them the information that they need about all kinds of different end of life issues. So between those classes and a real bevy of free resources hosted on our website, our Facebook, and our Instagram, and as soon as I get our new social media intern up and running, you might even see more of us on TikTok, which is very exciting. Well, I think it's exciting. I don't think my colleagues are looking forward to learning dance choreography, but some of us are excited. But, it's just a kind of a testament to how, we know this information is kind of challenging in nature, can be difficult to come across, and we want to meet people where they are, give them the information in different ways, and we'll find a way that's going to resonate and help resolve their questions. And so in addition to those education efforts, advocacy is super important to us. We work to support our state level legislature, as well as sometimes our federal level, to increase funeral choice, increase price transparency in a notoriously opaque industry, the funeral industry, and also working to protect cultural rights. If you spent even more than just a hot second up here in the Pacific Northwest, you know that we are blessed to have an incredible diversity of peoples up here. And everybody deserves equal access to affordable cremation, burial, aquamation, natural organic reduction, and all of the sort of essential cultural and spiritual practices that go into the process of mourning and celebrating the lives of the people we've lost. So like I said, we stay busy. As I mentioned, this is the last session in this series. Ducks in a Row is a 3-session series, but we did record the other sessions in these past weeks, and those are available by email as well as on SPL's YouTube channel. And again, I encourage you to keep an eye on our website at PMA. We do tons of community education. We're sort of winding down for the holiday season, but you can expect we'll be right back on it after the new year. So enough about me. The real reason that folks are joining us today is to soak up all of the good wisdom from Rebecca Hudson here, the client service manager from End of Life Washington. I love working with her, and I think you're going to learn so much from her. End of Life Washington does beautiful work here to support Washingtonians at End of Life. So I'm going to go ahead and get her slides up and hand over the mic. So just 1 second. Okay. All right. Oh. Oh yeah, people should see that. The people want it. Okay. I think you're all cleaned up. I just want to do.
If you left, look the left first slide. Slide down.
And that is that's weird, huh?
In my defense, I have an English degree.
Neither of us are tech people.
I know.
Thanks for bearing with us, folks.
All right. Let's try that. How about that? Is this not the beginning?
No, just put from the beginning.
Oh, okay. Just over there. All right, I think we're in business.
No, we're not in business.
What's the issue?
Oh, because this is like would be on my not sharing screen, right?
If you just exit and then try to share the screen, would be good. Like if you stay, maybe. I'm not sure. I mean,
You might need to come do what you're envisioning because I don't understand.
How did you do yours?
I don't know.
you can also just go down if you wanted to. You could just clear the section. Just use this if you want.
I don't know how to. Is that working? No, yeah, maybe.
It's just like. Yeah, it's
Okay. Sorry, everybody. We will. Trying to. I guess.
Yeah.
I guess we can do this. All right. Well, thanks everyone for being here. Thanks for the folks that came in person. This is the Ducks in the Row presentation on advanced care planning. We're going to talk about advanced directives today. As Bev said, my name is Rebecca Hudson. I am the client service manager at End of Life Washington. These are my ducks. They are in the row and for rare circumstance in this picture. So I just want to talk a little bit about End of Life Washington. So End of Life Washington really has sort of 3 things that we do. We do education and resources. So that includes presentations like this to community groups, to different organizations. We also present to healthcare organizations, to hospices, to provider groups. And then we are also involved in advocacy and public policy. So we were instrumental in getting the original Death with Dignity law passed in Washington State in 2008. We passed an amendment last year. We were also instrumental in the Protecting Patient Care Act that ensures healthcare providers' rights to talk to their patients about all healthcare choices, including medical aid in dying, gender affirming care, and reproductive healthcare services. So we're really involved in advocacy and public policy on choice. And then we also do direct client support. So we have volunteers that go out in the community and work with people one-on-one who are interested in either medical aid in dying or voluntarily stopping eating and drinking, other end-of-life choices, and we help them navigate those processes. We are a 501c3 nonprofit. There's a much like People's Memorial, we have a very small staff and then a whole bunch of other people helping us. So we're mostly volunteers and just a few staff members. And we are all almost completely individual donor funded. So what are we going to talk about today? We are going to talk about planning ahead, and specifically the documents you need to plan for future healthcare situations. So this includes a durable power of attorney for healthcare, a living will, a POST, which stands for Portable Order for Life-Sustaining Treatment, and then we'll also talk a little bit about dementia directives and a voluntarily stopping eating and drinking directive as well, which I don't have listed here. So talking about death. So I just want to acknowledge that today we are going to be talking about some tough situations. We're going to be talking about planning for end of life. These conversations can be hard. They can be difficult. That's why people use euphemisms like pushing up daisies. I don't use euphemisms. I think that it is important that I am clear and honest in my communication. Euphemisms also don't always translate across all cultures or socioeconomic statuses, so I will be very frank in my conversations today. But please just know, I know that you're here by choice. You're in this Zoom room or this in-person room by choice. But that doesn't mean that this might not bring up some feelings, some emotions. So if you need to step out, if you need to get some water, if you need to shut down your computer, I'm not going to be offended. I understand. And as Bev pointed out, we will make sure that all of these resources, the slides and everything, are available to you afterwards. So you can always come back and re-engage when you're feeling ready to do so. Yeah. A little tricky with the thing. So planning ahead. So the first step to planning ahead is choosing your support team. And we'll talk in a minute about choosing a durable power of attorney. That's the person that's going to legally be making decisions for you if you're unable to. But they're more than just that person that's important for supporting you, either at end of life. And when I talk about end of life, I'm also talking about any kind of serious healthcare situation where you're not able to make decisions for yourself. So this might be the end stages of a serious disease, but it could also be that you got hit by a bus and are unconscious and in a coma, or any other situation where you're not able to express your own wishes. Who are going to be the people that support you? For most people, this will include a medical provider. I do encourage people to reach out to their primary care provider and any specialists that you might be engaged with and have a discussion with them about the sort of things that you would want and see if they're in support of it. If you are the kind of person that maybe wouldn't want to be kept alive on machines, maybe wouldn't want heroic life-saving measures taken, is your doctor on board with that or your medical providers on board with that? It's okay to bring up that conversation, have that conversation with them. And if they aren't willing to sort of provide you the kind of care that you would want in those situations, you might consider looking for a different PCP. You also want to talk to your family, your loved ones, friends. Who are the people that are going to come and rally around you if you have a serious healthcare situation, if you do get hit by a bus, if something happens? Who are going to be the people that step in? And we want to start having conversations so all those people sort of know, what are your values? What is important to you? What sort of things would you want? Yes, you'll legally have one person that's going to be making the decisions, but it's sort of important that everybody in your circle know who you are, know what's important to you, know your wishes. So what if you aren't sure exactly what you are? What if you aren't sure what kind of decisions you might want to have made in a end-of-life situation or a serious healthcare situation? One thing that you can do is to complete a values worksheet. We have one available on our website, but there are a bunch of other ones floating around out there. You can just Google like healthcare values worksheet. It is an opportunity to help you and those that you've chosen to care for you to understand what your values are related to how you want to live. This isn't about specific diseases or specific symptoms, but it's really about how you value your health and welfare in general. What's important to you? What does living well mean? How do you define quality of life? How important is your independence? It's great to go over this values worksheet with your durable power of attorney and with your family, with loved ones, with friends, with whoever is going to be there, so they understand why you're going to be making the decisions that you make. This can help you understand what kind of decision you would want and also help them understand why you would make those decisions. And so it'll sort of ask questions like, how important is living independently? And if you rank living independently really, really high on your values, then that's maybe going to mean that different decisions need to be made for your healthcare to prioritize that over keeping you alive as long as possible, right? So there are things that you can kind of rank. How important are these things? And that can help guide some of the decisions that you put into your living will and the decisions that you talk about with your durable power of attorney. So now we're going to start diving into the actual documents, the actual legal documents that you'll complete. So when we say advance directive, what do we mean? We really mean a combination of two documents. And those documents are a healthcare directive, which some people refer to as a living will, and then a durable power of attorney for healthcare, which some people refer to as a healthcare agent. And so these are two different documents. End of Life Washington has combined them into one document on our website. So we have one available on our website. There is also one from the WashingtonLawHelp.org that is also a combined legal document. And then there are a whole bunch out there that are either a durable power of attorney or a living will. You really want to complete both of them. It doesn't matter if you do a combined document or you do the two separate documents. And a lot of times people ask me, well, which one should I pick? Which one should I do? And I say the most important, the best advance directive is a completed advance directive, right? So I have some personal feelings and opinions about which ones might make a little bit more sense than the other ones, yes, but really what's important is that you name a healthcare agent, you name a durable power of attorney, and that you have a living will that has some basics about the sort of things you would want or not want. They're all legally equal in Washington state. They all kind of match what is needed in Washington state to be a legal form. So really whichever one you come across, whichever one sort of makes sense for you to fill out is fine. The best advance directive is a completed advance directive. So the first thing we'll talk about is choosing your healthcare agent. This can also be called a durable power of attorney for healthcare. Some people will call it a healthcare proxy. This is a person who will speak for you and make legal decisions on your behalf in the event that you are not able to communicate for yourself. So this person, once you complete this document, has a legal right to say, do this treatment, don't do this treatment. Yes, give that medication. No, don't give that medication. So it's really important that you pick somebody who is going to honor your wishes, who is going to honor your values. And the other thing about this is we can have conversations all day, every day. We can complete a very thorough living will. And there is no world in which we are ever going to be able to tell our durable power of attorney what to do in every conceivable situation, right? There's just no way that we could know about every possible situation that might occur in healthcare and what you would want. So it's really important to, again, you could refer back to that values worksheet, but make sure that they have a good understanding, not just about specific things you would want in specific situations, but a more general idea of what is important to you. What do you want to prioritize? Do you want to prioritize staying at home for as long as possible? Do you want to die at home? Would you rather be taken to a hospital if it's going to prolong your life? Would you want to be kept on machines if you're likely to recover? Like what are the things that you want? What are the kind of things that you don't want in a general sense, so they know what kind of decisions to make for you? If you do not name a durable power of attorney for healthcare, if you don't have one, there is a legal hierarchy in Washington state. It's called the surrogate decision maker list about who will make those decisions. It starts with a spouse or domestic partner, adult children, parents, siblings. I think their next is like a friend who can affirm that they know you well. And I still think that everybody should have a durable power of attorney, even if the person that you are naming as a durable power of attorney is by default the person that would be your surrogate decision maker under the law. It's still a good idea to have the document. It makes it faster and easier in an emergency for the medical providers to just go, yes, absolutely, this is clearly the person that should be speaking. This is clearly the person that should be making the decisions. And they don't have to deal with trying to figure out who is that person, trying to figure out, like, is it somebody else? Is there possibly another adult child that should be involved? If you don't have a durable power of attorney and it goes to that surrogate decision making list, everybody sort of has to agree. So if you have 3 kids, the majority of them have to agree. And so if you have conflict between all 3 of your kids, it can get very complicated in a healthcare situation. Some people think that who you name as a durable power of attorney is going to be pretty obviously your spouse or the person that you live with, or your adult child, or if you're a younger person, maybe your parent. And that's not always the case. I think sometimes it's important to think about not only who understands you and your values and your wishes, but who's going to be able to make the tough decisions. Who's going to be able to say, we need to stop this treatment? Who's going to be able to say, we don't want to do that? And for some people, that might not be their spouse. For some people, it might be a different person who they want to put the onus of making those decisions on. I filled out my first durable power of attorney when I was 18, and I did not name my parents. I named my brother. And the reason that I named my brother is because I knew that I am a person who would not want to be kept alive on machines. And I knew that it would be incredibly hard for my parents to make that decision. And I knew that my brother would do it in a heartbeat. So I named my brother because he was the one that made sense. I had a client one time who had gone through a very extensive cancer journey, had been in remission for many years, had been married at that time and had a supportive husband who was at all the appointments, had gone through everything, knew what she wanted, knew what she didn't want, had had many discussions. They did divorce. Several years later, her cancer recurred. And she actually named her ex-husband as her durable power of attorney, even though she was actually in a new relationship, because her ex-husband was the one that like knew all the stuff, right? He knew her values. He knew what she wanted. He knew how she wanted to be cared for. So don't just go with the obvious choice. Really put some thought into it. Think about who doesn't make sense. The other thing I will say is that sometimes people worry about bringing up these conversations. They worry about like, I don't want to upset my kids by talking to this about them. I don't want to upset my parents by talking to this about them. And as hard as these conversations are, it's so much harder in an emergency crisis situation when your loved ones, when your circle of people don't know what you want, right? So having these conversations, naming this person, doing all of this ahead of time really is a gift to our circle of people. It is really a gift to our loved ones so that they are ready, even when something happens to you in the future, they aren't scrambling in a crisis moment to figure this all out. So we talked about the durable power of attorney. Again, we have a combined document. If you're not using a combined document, usually you just put the person's name, their address, your name and address, you sign it, usually in front of two witnesses or a notary, and then it's done. And we'll talk a little bit about like what completing it looks like when we have a combined form. But then the next directive, the next step is the living will. And this is the document where you kind of talk about the things that you would want or not want. So you put down in writing the types of decisions you would want made if you're in a situation where you can't communicate for yourself. And this is really meant to be a guide for your durable power of attorney. If there is a situation where your durable power of attorney isn't able to be reached, isn't able to answer the questions, maybe says, I can't make these decisions, I don't know what to do, the healthcare providers will use the living will as a guide and sort of use it to help them navigate and make decisions. But in general, they're going to default to what that durable power of attorney says. And the living will section is really meant to be a guide for that person to refer back to. And also to help support a decision if maybe your durable power of attorney is making a decision in line with your wishes that maybe isn't something that the healthcare providers think is great or think is the idea that they would make. This durable power of attorney can go back and go like, no, look, it's in the living will. This is clearly what Rebecca wanted. She clearly stated these wishes. This is what we need to do. So it's really important to have both pieces and they kind of work together. So completing your advance directive, what does this look like? So you name your person. On almost all durable power of attorney forms, you can also name an alternate. I do recommend that people name an alternate. Questions that people ask, does the person need to be in Washington or in wherever you are? The answer is no. And that said, you should definitely name somebody who is easy to get a hold of, right? You don't want to name your like cousin Joe who never answers his phone and like lives in an off-grid cabin somewhere. That's not a good choice. But you know, name someone who is able to answer their phone, will be able to get a hold of you. I would recommend that either your durable power of attorney or the alternate be somewhere where they could get to you within a few hours. Medical providers will take things over the phone from durable power of attorney. They will ask questions and make decisions over phone calls, but it really works better if that person can be in person. So you name the durable power of attorney, you name an alternate, you fill it out. You fill out your living will where you talk about, yes, I would want to have everything done to me, or I wouldn't want to be on machines if there's no hope for recovery. Things like, do you want antibiotics? Do you want blood products? How do you feel about organ transplantation? You can kind of get specific on these about the sort of things you would want or not want. And then you're going to sign it. In Washington State, it is equally legally valid to sign in the presence of 2 witnesses or a notary. If you are planning to travel, so if you are somebody that, you're a snowbird and you spend half the year in Arizona, you only need one advance directive. You don't need one for every state that you go to. But in that situation, I would recommend that you notarize it just because it adds a little extra layer of legal validity. Some states do require that their advance directives be notarized. So getting it notarized just means it's going to be more likely to be accepted in other states. There are some states that might put up a fight against accepting a Washington State advance directive. So again, if there's somewhere that you go frequently or spend a lot of time, it is worth looking into the laws there and figuring out if you might need to do something different to accommodate their state's requirements. What do you actually do with the document after you sign it? Where do you put it? The answer is not a safe that only you know the combo to. Yeah. You want to make sure that this document is somewhere where people can access it in an emergency. So we have like a drawer in our house that has a bright yellow folder that says emergency, and it has all of our advanced directives that has like cat medical history and the vet information and all the sort of if there's an emergency, here's who you need to contact about what. And then let people know where that is. You want to make sure that the person that you name as your durable power of attorney, as well as the alternate person, get copies of it. And with this document, copies are just as valid as the original. So I always suggest that people hold on to their own original, but it honestly doesn't really matter. The copies are just the same. So make a bunch of copies, give them to the people you're naming as your decision makers. You also can get it scanned into your medical record. So every hospital system in Washington State does have an electronic health record system, and they can and should scan it in. So you go to your PCP or you go see your neurologist or your oncologist or whoever it is, you can ask them to scan a copy into your medical record. And that's really great because then it's just accessible there if you end up in the hospital or you end up in the ER. So if you want to change it, if something changes, addresses and phone numbers can just be marked out in initials. So if your durable power of attorney moves, you want to make sure that, or they change their phone number, you want to make sure that your documents have updated information so you can just mark it out, write their address, write their new phone number, sign it. You do have to do it on every copy. So you'll have to kind of track down all the people that you gave copies to. Anything else that needs to be changed means that you need to make a new directive. So if you want to change the person that you are naming as your durable power of attorney, or if you want to change anything you've put in your living will about the things that you would want or not want, you just need to create a new one. I do recommend that, again, you kind of try and track down the copies that you've given out, and you can just shred them, tear them up, put them in the recycling, and then make a new one. Whatever is the most recently dated advance directive is going to be the legally binding one. So if for whatever reason you can't get all your copies back, if your son Joe and your son Bob both show up in the emergency room with copies of your advance directives that say one of them is the durable power of attorney, it's going to be the most recently dated one that is going to be legally binding. So a couple of additional directives to talking about. So End of Life Washington has created a directive called Living with Dementia Mental Health Care Directive. This is specifically for people who have been diagnosed with Alzheimer's or another form of dementia and are still in the early stages, or sometimes people that have a very strong family history of dementia and are concerned that they are likely to develop it will also fill this out. It goes into lots of detail on things that are can be specific to dementia. Like, what would you want to have happen to your finances when you're no longer able to manage them? What would you want to have happen with your car and with your ability to drive when it's not safe for you to drive? How do you want that conversation to happen? Who do you want to be the person that's going to take away your keys? I will just be frank that it also goes into some very personal things that people don't always think about. So it even has a section on like intimate relationships in memory care facilities. It is not uncommon that people are in a memory care facility, they have forgotten that they are married or in a intimate relationship, and they develop feelings for somebody in this facility. And how would you want that to be managed? How would you want to navigate that? this is not legally binding in the same way that like the living will and durable power of attorney are, but it again can be used as a guide for your durable power of attorney to sort of help you navigate this process. And it can also be a great thing to sit down, talk to your loved ones, talk to your circle of people about how do you want to navigate these things when they happen? How do you want to be taken care of? Who do you want to be taken care of? Do you want your family to be the ones doing personal body care? Or if finances allow, would you prefer that they hire somebody to come in and do bathing and showering and that kind of thing? So really kind of talk about these important things that often people don't think about until it's too late and they're not really in a position to be able to have those conversations. And the other directive that I will talk about is called My Instructions for Oral Feeding and Drinking. And I will say it is, we are phasing that out while we are phasing in a voluntarily stopping eating and drinking directive that is developed by the Northwest Justice Project. This is also often used for people in either the early stages of dementia or with some other specific healthcare situations where often in the late stages of dementia, people stop naturally wanting to eat and drink. In some facilities, they have they struggle to honor that, and they will force feed people. They will kind of like try and spoon feed you. They will really pressure you to eat or drink. If that is not something that you want, it is important that you have a directive that says, you know, if I close my mouth, if I turn my head away, if I'm not showing interest in food and water, I don't want to be fed. I don't want to be hydrated by force. Just like every other medical decision on the planet, right? We all in America, we have the right to refuse medical treatment. We have the right to refuse medication. We have the right to refuse interventions. You also have the right to refuse food and hydration. But it is important that you clearly lay that out. So the voluntarily stopping eating and drinking directive does go a step further, and it does allow you to indicate that if you are in a situation where XYZ happen, and you can kind of lay out the things. If I'm not able to communicate, if I'm not able to interact with my loved ones, I don't want to have any food or water. And then that empowers your family, that empowers your loved ones, that empowers your surrogate decision maker to really stop any hydration and nutrition. And that can be a peaceful way for folks in the end stages of dementia to die. All right. One more form that we're going to talk about is the POLST form. It is the Portable Order for Life-Sustaining Treatment form. This form is only used after the diagnosis of a serious illness or sometimes for the very, very elderly who are at the end stage of life. Unlike all of the other documents that we have talked about, this is a medical order. So it does have to be done with a medical provider. So all of the other documents you can do in your living room with your friends, sign them in front of two witnesses. Maybe if you want to get it notarized, you do it, you go to a bank to sign it and get it notarized. But this you do have to do with a medical provider. And this is sometimes referred to as like an out-of-hospital DNR. So what this is really for is the sort of people that have POLST, or let's say you've been diagnosed with cancer, you're at the end stages of cancer, you're on hospice, you're likely to die in the next few months, and you have a heart attack, and somebody calls 911. Do you want EMS to come in and do CPR and attempt to revive you and save you from your heart attack, to then just you'll be in the same place of like dying of cancer? For a lot of people, that is not something that they would want. And so this is really for EMS. This is a document that is completed with a physician, and then you take it home with you. You put it on your refrigerator, or maybe if you're in hospice and you have a hospital bed, you put it on the hospital, above the head of the hospital bed, somewhere very obvious where if emergency medical services are called, they can come in and they can say, hey, this person doesn't want us to do CPR. This person doesn't want shots of adrenaline. This person doesn't want us to do these heroic life-saving measures. And I will say, like, this is a choice option. It can also go the other way. The form can also be used to say, like, yes, absolutely, I want everything done. It doesn't matter that I'm, have cancer and I'm already dying. Yes, I want you to do CPR, because you have that choice, right? People get to choose what they want. So it allows EMS to know what you would want and to know which way you would want things to go. We're gonna have a couple little summary slides and talk about all the things that we talked about, and then we'll have a big chunk of time for questions. So all adults, everybody who is 18 years or older, I think, should complete an advanced directive that includes that document the durable power of attorney where you name the person making the decisions, and then the healthcare directive, also called the living will, where you kind of lay out the things you would want or not want. You do want to think about these periodically. So we call this presentation an introduction to advanced directives, and I will say sort of advanced directives, the conversation should never stop, right? You have the conversation with your durable power of attorney, you have the conversation with your loved ones, with your circle of people. Don't just leave it for 30 years and never come back to it, right? As your life changes, as your health changes, as your family's makeup changes, as other people's opinions change, all sorts of things can shift. So it is important to sort of regularly come back to your people, have these conversations, remind people of what your values are, maybe pull out that values worksheet you complete and be like, I just want to let's chat about this. I do this at Thanksgiving every year, which my family loves. We go around the circle and it's like, what are we thankful for? And I say, I'm thankful that I have a legal right to have the decisions I want honored. Would maybe, choose your time and place. Again, as I do really view this as like a gift that we can give the people around us, that we're letting them know what we want so they don't have to deal with it in a crisis moment. So keep having those conversations. So update periodically as needed. And then if you are living with a serious illness, you should consider evaluating the need for a pulse. And this is the conversation that you can have with your medical providers. That can also be updated as status changes. So maybe initially you want some things, maybe you would want the antibiotics if you just had an infection, but you wouldn't want CPR, and that's okay. You can be that specific on a pulse, but then maybe as you're closer to the end of life, you decide, I don't actually want anything. I don't want any intervention. So, just like the other documents, the pulse is something that you want to reevaluate occasionally and update if anything has changed. So just to summarize, you can complete a values worksheet, complete that advanced directive, evaluate need for a pulse, and then way back at the very beginning, we talked about choosing your support team, talking to your medical providers, talking to your circle of people, and just making sure that everybody understands what you want. Really, my last thing is just to talk a little bit about the limitations of advanced directives. So advanced directives die when you do. Some people think that, oh, this person that I'm naming as my durable power of attorney is going to take care of everything through end of life and after, and that is not accurate. So if you have specific wishes concerning organ donation, your body disposition, so what happened, or burial, cremation, that kind of thing, your funeral arrangements, then you need a separate piece of paperwork. You can fill out a piece of paperwork naming a disposition agent. People's Memorial Association has one on there's a couple other ones floating around, but I do think theirs is the best. So it is important. A lot of times it's going to be the same person. You might very well name the same person, but you still need that second piece of paperwork naming the person that gets to be in charge of all those funeral arrangements, body disposition. And I will say, just as there can be lots of conflict about making healthcare decisions, if you don't have a durable power of attorney name, there can also be tons of conflict around, what are we going to do with mom? Are we going to bury her? Are we going to cremate her? What kind of funeral are we going to have? Who's going to do this? So really naming a person to do that is also critically important. Your healthcare agent has no authority over your will or estate. You need a financial power of attorney for this. The one little asterisk there is that they can't access your medical billing. So if there is a concern from like your insurance billing or the hospital billing, that is something that your durable power of attorney for healthcare can be involved in. But any other financial matters, you need a financial power of attorney. And we talked a little bit about advanced directives possibly not being honored out of state or out of the country. So you do spend a lot of time traveling. It's worth just looking into the rules and legislation in those areas to understand their requirements. So any additional end-of-life planning things that I think are important? We talked about the designated agent for body disposition. Account and password management is something to think about. What happens, who's going to be able to get into your bank accounts, who's going to be able to get into your email. I recommend somebody that has access to your password, so they can manage your email and social media accounts and all of that stuff. And all of these things, People's Memorial Association has a lot of great resources for. So they are the folks to go to with all those questions or to do all of those other end of life things. And that is it for me. So questions and discussion. Happy to talk about anything. I can't see if there are questions in the Zoom, so I assume you will. Yeah.
I have a question for you that we get asked a lot is, where is a good place to put these documents? I know you've mentioned like multiple multiple copies, things like that, but, I've heard a lot of people put them in their lockbox and then they don't tell their kids where they're at or their partner where they're at, and they're just expected to know where to find them.
Yeah. So I think it a little bit depends on your living situation and kind of what's up. We have like I said, we have a drawer that's like in our kitchen that I should probably like put a piece of tape on that says like the emergency drawer or something that has all of our documents in it. Some people will like put things in a manila envelope and clip it on a clip on their fridge that just says emergency. So that is also a great option. And again, making sure that your providers upload it to your medical record, because then there's like an online version in your healthcare record that all of your medical providers can access, is really important. Yeah, don't hide them. I also recommend that you maybe like put one in your glove compartment of your car so that if you end up somewhere unexpectedly needing in an emergency situation, that you have one accessible there. If you're traveling, just stick one in your suitcase. I have one that just lives in my suitcase and never comes out, so it's always there. And then tell people where you put them.
We have someone in the chat that asks, anything beyond ensuring access in notarizing documents to help when someone travels extensively?
Yeah, so I think it's a little bit, I think, yes. So you want to make sure that your document is notarized. And then it really depends on where you're traveling extensively to. If you're going to a whole bunch of different areas, it can get hard. Like if you're a snowbird in Arizona, you should just look at what the laws are in Arizona and figure it out and see if you need separate documents there. And if you know that, like, if there's one hospital system in Arizona, you can even sort of like connect with that hospital system and figure out what they would want, if they would accept your documents. If you're going all sorts of different places, the best thing is to have it notarized, and then make sure that your durable power of attorney is reachable, and that they're going to answer phone calls from wherever you're going, right? So like make sure they know, hey, I'm going to Tasmania. You might get a phone call from a really weird area code. Please answer it, because that's probably somebody calling about me. Most places, even if they have different rules about the documents and about the notarization, will accept a durable power of attorney. And especially if you have the document and they call and that person answers and says, yes, I'm the durable power of attorney, most places will accept that. But you need to make sure that that person is going to answer the phone when they get a call from wherever in the world you have jaunted off to. Outside of the US, things can get very weird, especially in some other countries, and you really just need to look into the laws in those countries and figure out what's going to be important. The other thing that I will say is to if you have a serious medical condition and are traveling, or if you anticipate possibly something would happen to you, to make sure that you also have your medical provider's information accessible, so that if you end up in a hospital in Tasmania, you can give them your PCP's information, and make sure you've had a conversation with that PCP about what you want, because sometimes if a medical provider won't necessarily listen to your DPOH, or won't listen to your son, or won't listen to your spouse, if they call your doctor and your doctor says, no, Mary Sue said she would never want this, please don't do this, they're going to listen to that doctor. Yep. Yep. Yep.
And you are managing perhaps a serious condition. Yep. They might have recommendations for, here are backup plans for accessing medication, or here's the type of documentation you need to carry with you. So if you go to the hospital, you already have this with you. So it's good to kind of just have some open conversation with them about kind of what their recommendations would be. They might pick this up,
Yeah, so folks on Zoom couldn't hear that. If you do travel extensively, worth having a conversation with your medical providers about what sorts of records you should take with you, what sort of documentation information you should take with you, that could be useful to people wherever you're going. Yeah.
On a whole priority list.
So sometimes you'll see two alternate spaces on a document. I really wouldn't recommend like trying to fit in a whole bunch of different people. What's going to happen is that they can't access the durable power of attorney and they can't access the alternate. They'll look at the Washington State Surrogate Decision Makers list. But what they'll also actually do in reality is just sort of, I will say, almost always providers are going to default to more treatment. So if those people are not accessible, even if you have a living will that says you wouldn't want things, they're going to default to saving you. They're going to default to keeping you on machines. They're going to default to treating. So yes, important to have that living will that says that that's not what you want. Important to have talked to your PCP. So hopefully your PCP finds out you're in the hospital and can come in and intervene on that. The problem with naming too many people is that people can get confused about where they are in that list, right? And so there isn't really any way to have more than just one and then an alternate. And if you have a whole list of people, maybe like third or fourth person down is going to think that maybe they should really be the second person. And they're going to get in an argument with that second person and they're going to want to make decisions. And there really isn't a legal framework to sort of separate where they would be. Yeah. Yes, Bev. Question in the back.
I shouldn't have a pulse because I have a tattoo that says DNR. Could you talk about alternative ways of documenting your wishes and their legality?
Yes. So Bev's question was, she as an EMT would have people that say, I don't need a pulse because I have a DNR tattoo. Tattoos are not legally binding. Nothing other than a durable power of attorney, living will that conforms to the statutes required by Washington state law is legally binding. I think it's very unlikely that you will find a document that doesn't conform to our statutes because our statutes are pretty vague and how a document has to be legal. It does have to have two witnesses on it, but all of these other things, so tattoos or like a bracelet, I know that there are like some registries where you can have it's very popular in like the backcountry hiking and like mountain biking community where you like have a bracelet that like has all of your medical information in it and stored. That registry itself doesn't have anything legally binding in it. If your durable power of attorney is stored in that database, that's great. You should do that. The other thing is I do recommend having ways to get your emergency contact who your durable power of attorney contacted. So my lock screen on my phone has in case of emergency and my durable power of attorney's number so that if I'm in a car wreck or something, somebody can pick up my phone without even having to unlock it, just look and see who my emergency contact is. But that sort of thing isn't legally binding. So they're going to call that number and Chris, my partner, is going to show up at the hospital with our durable power of attorney paperwork and be like, this is me. Just having him listed as in case of emergency on my phone is in no way binding that he gets to make any decisions or make any thing for me. So yeah.
Could you talk about that? I know we showed people how to use the like health app on their phone, like when EMTs do like find someone, sometimes they'll look in those like blood type and things like that.
Yeah, so again, all of that is good to have, and it should all be a supplement to the things that we've talked about today. And in general, an EMT is not going to look through your wallet for any sort of card. They're not going to start searching through your phone to figure out the things that you would want or not want or that kind of stuff. They're going to prioritize saving your life, right? And they're going to prioritize doing things to save your life. It can be very hard for people that do not want any life-saving treatment in those sort of situations. That's why the Pulse form exists, and it's called a portable order for life-saving treatment because it is portable and that you can take it with you wherever you go. Now, if what that really means is that you have it in your home, and then if you move to a memory care facility, it can go with you to the memory care facility. If you end up in some sort of assisted living facility, it can go with you there. It's not really meant to be used like in a car. If you were in a car wreck, that said, if you are traveling between place A to place B and you are have a serious enough illness that you need a pulse, I would make that pulse somewhere visible in your car. Can I promise you that an EMT is going to see it and know what to do when they come across a pulse in the middle of a car wreck? No. But better than not having it. But all those health apps and stuff on the phone are really, they're a little gimmicky. I mean, they're not wrong. They're just like, they don't have legal precedence. They're not going to be used most of the time. And maybe if you're like, waiting for a tow truck or something, and I don't know, but I don't think they're as useful. Maybe Bev's the EMT, so maybe she can yeah. Yeah, it's above their pay grade. Yeah. Yeah. Yeah.
Yeah, I agree with this. So I think it could be a good thing, like sort of a flag to people that you do have some kind of
Yes.
stuff. Some
Yeah.
unlikely that EMS is going to look through your phone, but if you're in the hospital and you can't get a hold of anybody, you might look through your
Yeah.
hospital that oh wow, okay, so they've got something documented in here. Okay, well this can be a starting point for us, but it's certainly not.
Yeah. So as Bev was saying, for folks that can't hear, those things can be a good starting point, can help people understand that you have something documented, that you have specific needs or specific desires, but they're not legally actionable. I will say medical alert bracelets are a great idea. If you have allergy to something, especially if it's like a medication that you could be given in the field, or if you have a serious healthcare condition, it's great to have a medical alert bracelet. And again, that is really just a sign that they need to investigate further. That's really just a, hey, this person's wearing this bracelet, I should probably like dig a little bit. They're none of those things are legally actionable. Yes.
Responders find out about it, but they won't care for this one, which is a very common anxiety. And I can tell you with surety that we have no idea if you're a donor because we don't have time to go through them all.
Yeah.
If you're injured or sick, so much to the extent that you're concerned about being an organ donor, we're very focused on what we're doing, and we do not have time to go through your stuff. So we wouldn't have any way of knowing that. So it doesn't impact the care that you'll be receiving. And it's also important to know, like, if you really think your way through it, in order for you to be an organ and tissue donor, you have to be healthy enough to donate. So even if we were up to something sneaky, it's in our best interest to take care of you really well, so you're a good donor.
Yeah, right.
So sometimes that holds people back, from being because they worry that they'll see a sticker on their driver's license or something, and you'll get care that's horrible.
Yeah. So for folks on Zoom that maybe couldn't hear, we were talking a little bit about organ donation, and that some people might be afraid to note themselves as a donor on their driver's license out of fear that in a car accident or in an emergency situation, they might not get the same level of care as some sort of like healthcare provider's sneaky way to get organs. And that's just not accurate. People are going to be far too busy taking care of you and keeping you alive to go through your stuff or make that determination. And also, as Bev pointed out, in order to be an organ donation, you need to be healthy. You need to have had blood circulation of, so it's in everyone's best interest, even if they do want you to be an organ donor down the line, to take care of you and keep you alive and keep you in a good state. Yeah.
There are professional or community-based alternatives to this ideal trusted friend or relative?
So that's a great question. The question was, are there community-based alternatives to the idea of like a trusted person for a durable power of attorney? Not to my knowledge in Washington. That does exist. There are places that are doing that. There are people that do this for hire. So there's a website called Health Advocate X, and you can, if you don't have someone who you feel comfortable naming, you can basically hire and pay somebody to be your durable power of attorney for healthcare. I have some personal sort of ethical qualms about that option, but it is a legal option. That is a path that some people choose, and I also understand that some people just don't have anybody, and so it's important that everybody have somebody to speak for them. But I do think that it is, well, you need somebody that understands your values. You need somebody that is willing to show up, to be there, to speak for you. You might want to think outside your normal box, right? And like some people think like, oh, well, I don't have anybody. I'm like, well, have you talked to maybe your spiritual community? Have you talked to your book group? Like what other circles are you in where it might surprise you that Susie from your book group actually like used to be a nurse and is like all about this, and it would love to be your durable power of attorney for healthcare. So before people give up on like, I just don't have anybody, I don't have anybody to name, I sort of encourage them to look through the groups that they're in, think about their network and who might be somebody that's willing to do this.
literally.
Yeah. Yeah.
These two little old ladies came into our office once, and they had moved into residential care because they both had physical disabilities and could support it. And they met each other living next door to each other in the facility, and they just hit it up and became best friends.
Yep.
And they just, they see each other every day, and they outlived the rest of their family, and they decided, like, gosh, I hang out with this person every day. They get me. They understand what I'm going through because they're going through it too. And this is my person. And they had no relation up until that point, but you have the power to be anyone. So it doesn't have to be necessarily your spouse, your kids, the people that you kind of might normally associate with. And sometimes it's almost better to pick people outside of your family because it does talked about, like, gosh, it can be have an extra level of complexity to put these kinds of tasks on our parents or children, and they might carry like an extra level of I hate to call it a burden, but they have some deep feeling. They might, it might be harder for them to carry out their wishes.
So pick somebody who cares just enough, but not too much. Yeah, like my brother. Yeah.
Anyone like to use your room, but I think we are good to put up your contact.
Yeah, so that's my contact info, services@endoflifewa.org. You can also call or text my phone, but will be honest that I don't usually answer my phone, and I'm faster to reply to an email than I am to respond to a voicemail. So that email is really the fastest way to get a hold of me. We're always happy to talk through these things with people. I can direct you to some other resources if you need like more in-depth help in filling out the documents. Yeah, I'm pretty passionate about sharing this information and making sure that everybody has these documents. So if you ever have questions or thoughts or anything, always happy to connect and talk to folks. And that's it. Thank you.